So this gigantism is seen in childhood, that means before adolescence, before the fusion of epiphyseal plate. Amino acid uptake in the bones causing the bones to grow. There will be linear bone growth. The bone length will be increased. So here you can see the person with a tall stature, like up to 8 feet, and hyperglycemic conditions can be seen because of, as it is a diabetogenic hormone, you can see this hyperglycemic conditions. It leads to breakdown of glycogen, converting it to the glucose, which increases in the blood, causing this diabetes mellitus. And also you can see this gynecomastia, weight gain, lethargy, sexual function can be lost, adrenocortical insufficiency can also be seen. Now coming to the acromegaly, it is seen in adulthood after the adolescence, that means after the closure of this epiphyseal plates. Once the epiphyseal plates are closed, there is no further linear growth, increase in the thickness of the bone but not the length. So here the linear growth cannot happen. There will be disproportionate growth of organs, of membranous bones and of limbs, causing organomegaly, of membranous bones causing acromegaly phases like protrusion of jaw and frontal bossing, and also limbs enlargement causing carpal tunnel syndrome. So these are the conditions in acromegaly. So the important thing you have to remember with respect to gigantism is there will be increased risk of heart failure. In the patients with gigantism, there will be increased risk of heart failure. And in patients with acromegaly, there will be increased risk of this colorectal cancer or the colorectal polyp. So gigantism, heart failure, acromegaly, colorectal cancer. I have a mnemonic for every important point in gigantism. So gigantism, it starts with the letter G, right? So it stands for gynecomastia, hyperglycemic conditions and gaining weight, lethargy or sexual function is lost. And also the important thing you have to remember somehow is heart failure condition. Acromegaly has C in it. And the A here stands for adulthood because this disease occurs in the adulthood after the closure of epiphyseal plates after adolescence. And C stands for increased risk of colorectal cancer. The cap size is increasing, which indicates the frontal bossing. The forehead size is also increased because of the disproportionate growth in the membranous bones. And coarse features, which are also called as acromegaly phases, like protrusion of jaw, frontal bossing, nose and cranium is increased in the size. Other C stands for carpal tunnel syndrome. What is happening here? The forearm bones are enlarging, which compresses the median nerve, causing this syndrome. So C stands for colorectal cancer, cap size is increasing, coarse species or the acromegaly phases, and carpal tunnel syndrome. Bye.